So, good morning and welcome. It's a cold morning here in Nairobi, and we start our discussion today early about life after blood clot, post-thrombotic syndrome. So, you survived a DVT, but your leg still hurts, your leg is still swollen, and it feels heavy every day. You may be suffering from a condition we call post-thrombotic syndrome. This is a chronic condition that affects 50% of the people after treatment of deep vein thrombosis. So what is PTS? So DVT can damage the small veins in your legs. You have small valves in your legs that allow blood to flow in one direction. Those valves allow blood to flow from the legs all the way to the heart. So once you suffer from DVT, and even after completion of treatment, those valves can fail. They can get damaged and blood pulls back in your feet instead of traveling to the heart. Imagine a leaky tap. So once the valves are damaged, once those small veins are damaged, the blood pulls in your legs, causing swelling. It will cause pain and heaviness, some skin changes, and in severe cases, you can develop ulcers or wounds. PTS or post-thrombotic syndrome is not just uncomfortable, but it can limit walking, sleep, or even quality of life. So what are the symptoms of PTS? PTS is post-thrombotic syndrome. So what you experience is the leg remains swollen. After a clot, the leg never goes back to the normal size compared to the other leg which was not affected, and it never fully goes away. You can also have aching, throbbing, or even clamping, which is worse on standing or even walking. You may find your legs are okay in the morning after sleep, but as the day progresses, the leg gets more swollen. It gets clumpy as you walk. You can also notice some skin changes on the leg. It may be dark, it may be dry, and there may also be cracking or tightness of the leg. There is also a heavy, tired sensation of that leg. The leg just feels uncomfortable. It's not like the other leg. And I've said in severe cases, you develop ulcers or wounds that develop on the lower part near the ankle. So severe cases lead to development of ulcers, and you can also have what we call chronic venous insufficiency. I have said earlier why PTS develops. A clot blocks blood flow, increasing pressure in the veins. So due to this high pressure, the small valves and the small vessels get damaged. And even after the clot heals, those valves experience permanent damage and lead chronic problems with circulation. You get chronic venous insufficiency. So how can we prevent this condition? We have said it affects about 1 in 2 people after they get a deep vein thrombosis. So how can we prevent? One of the key things is early and complete treatment of DVT. You need to recognize DVT early, get the right treatment early, and complete the treatment as per your doctor's instructions. That's why we are having this VTE awareness series, so that we can diagnose early, treat early, and prevent the complications. And one of the complications of DVT is the PTS. Number 2, once you are diagnosed with DVT, let your doctor prescribe what we call compression stockings, graduated compression stockings. This should be prescribed as soon as deep vein thrombosis is diagnosed, so that they can ensure the swelling of the leg decreases and the leg goes back to the normal size. So graduated compression stockings are very key to preventing PTS. They should be correctly measured. You have to wear the right size. They should be tight but not painful. And we are saying graduated compression stockings. They should be put on as soon as DVT is diagnosed. Number 3, when you are sitting, put your leg in an elevated position. Raise your leg. Stay active. Keep walking. This allows, remember earlier we had talked of the muscle pumps that are in the calves. This allows the pumps to continue functioning. And then number 4, maintain a healthy weight. So weight loss is very important in dealing with chronic venous insufficiency. Right diet, exercise, maintaining the target weight. And finally, regular follow-up by your doctor. please follow your doctor's instructions. Once DVT is diagnosed, right treatment, complete treatment, have your compression stockings. And if you develop PTS, post-thrombotic syndrome, please see your doctor. There are medications that we use to treat the PTS. They may not reverse it completely. Some examples are medications like Daflon, Dobesilate, in addition to the compression stockings. So please remember, if you suffer from PTS, PTS can be avoided, and if it occurs, please see your doctor so that you can have a discussion more on the measures that you can do to make the PTS less. Stay tuned for the next post where I will talk life after blood clot part 2, and I will discuss about post-PE syndrome and chronic thromboembolic pulmonary hypertension. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.